Thank you, Madam Chairman. The United States is reported to consume about 90% of the world's opioids. And part of this goes back to something that was in the Affordable Care Act that mandated that 1% of Medicare inpatient payments be withheld from hospitals based on patient satisfaction. And this is something that we had a field hearing in this committee. Madam Chairman, you may have been there at Johns Hopkins Hospital, and we talked about this as part of the problem. The issue that I want to bring up is the role of Purdue Pharma in pushing this. The Joint Commission is a U.S.-based nonprofit tax-exempt 501 organization that accredits more than 22,000 healthcare organizations' programs. According to a Wall Street Journal article, the Joint Commission published a guide sponsored by Purdue Pharma on pain management. The guide reportedly stated some clinicians have inaccurate and exaggerated concerns about addiction, tolerance, and risk of death related to the use of OxyContin, and said there was no evidence that addiction is a significant issue when persons are given opioids for pain. What I would like to know from Mr. Landau is, did Purdue Pharma fund that any of that research done by the Joint Commission?
With respect, Representative Palmer, I don't know. I said in earlier testimony that before becoming CEO, I was entrenched in research and development, and that would have been in an area outside of my area of responsibility. I could get back to you certainly after the hearing with that information.
Mr. Sackler, did Purdue Pharma fund any of the research published by the Joint Commission?
I simply don't know. I unfortunately.
The answer to the question is yes. There was OxyContin was approved by the Food and Drug Administration in 1995, and your company mounted an aggressive marketing campaign that included a warning that the FDA warned in 2003 was misleading. Are you aware of that?
My recollection is that the FDA's warning letter in 2003 related to a single ad in a journal article.
But what I'm pointing out here is what appears to me to be a intentional effort to mislead not only patients, but physicians and hospitals. And working through the Joint Commission, which has tremendous influence, obviously they're an accrediting organization, and that your company has heavily invested in them. They're a 501c3. You've made significant contributions through your company to the Joint Commission. And it seems to me that obviously Purdue knew that there were major problems with OxyContin, but you aggressively and I think in a dishonest way push this drug on doctors, and it only ramped up after the changes in the Affordable Care Act that made pain management one of the key factors in whether or not hospitals could get their full payments from Medicare for taking care of Medicare patients. The Joint Commission even went so far as to frame pain management as a patient's rights issue. That's disturbing. I just want to know how much money Purdue Pharma put into the Joint Commission.
I don't know.
Well, would you be willing to get that information, or Mr. Landau get that information and provide that to this committee?
Yes, I'll take that request back for sure, Representative.
Okay, Madam Chairman, can the committee make sure that they follow up on that? You're muted.
Good point. We will follow up. Thank you.
Thank you very much. I see that my time has expired. I would just like to conclude by saying this, that Alabama has the highest use of opioids in the country. Now, I know West Virginia has the highest death rate. When we had this field hearing at Johns Hopkins, there were plans in place to remove the pain management from the ratings for the hospitals, and I think that's been done. But it was only after we were seeing 60 to 70,000 people per year die from drug overdoses. This is an unspeakable tragedy that has taken place in this country. And I think Purdue has a tremendous responsibility here to make it right. Madam Chairman, thank you for the indulgence. I yield back.